Hello nurses, welcome back to my channel. This is RN Sakshi. So today I'm back with the topic onychomycosis. So this is been important topic for NCLEX RN, either your REXPN exam, because sometimes nurses do not know that what this term defines for, right? So onychomycosis is an infection which occurs on the nail, and sometimes it's surrounding tissue. Attached is the picture you can see, right? So we have those two classifications in the picture. So this condition is extremely common in 20% of general population and 75% of people over 60 years old. So the problem, frequently causes concerns like of cosmetic concerns, especially, but various patients also experience pain. Most of the time, onychomycosis can allow more serious infections to develop, so diagnosis is must. So you can see in the picture that onychomycosis is an infection of nail by fungus. So fungus, where do fungus usually survive? In the warm, moist environments, right? So toenails are most commonly affected by nail fungus rather than fingernails. So you can see in the attached picture that the first picture depicts that it's thickened yellow nail, right? The nail is kind of thick and it's yellowish in color. The second picture depicts yellow streaks on the nail. You can see in the picture that what the yellow streaks on the toenail look like. It's just the horizontal lines which can be visible on the toenail. So only top layer of the nail is affected in onychomycosis, like superficial layer. So the what can be the etiology of onychomycosis? So multiple fungi species, are dependent, or you can say contribute to this onychomycosis. So fungus infection, is one of the limited foot issues that affect more men rather than women. Like 70% of proportion men is affected rather than women if you walk barefoot, especially, right? And for example, especially in showers, if you walk barefoot, if you are wearing kind of artificial leather shoes, if you're wearing shoes of another person, right? Like tight restricted shoes as well, because it can contribute to vascular dysfunction, right? So if your foot or like toenail will not get enough proper blood circulation, of course it lies under under the vascular dysfunction. So there will be no proper blood circulation that can also cause some kind of foot infections or toe infections. So age is a factor too, and half the sufferers are people who are more than 70 or 60 or 70. So other risk factors having you can have also, like if you have any medical conditions. So there are many medical conditions which are can other conditions which rely under this is if you are diabetic and if you are having vascular insufficiency or malnutrition, right? So nutritional deficiency, so you know that you can correlate this condition with the diabetic, because if people are diabetic, then they have mostly foot problems, nail problems. We have to properly care for their feet, so that's why it can be correlated, right? So other thing is like vascular insufficiency, has I have already mentioned that if there is no proper blood circulation, so diagnosis depends, like if like it depends upon the multiple factors. So it is must that you should go to doctor, because sometimes people get confused that either it is psoriasis or onychomycosis. So what the doctor will do, they will just do the scrapings of your nail, and so this is not an easy condition to cure, so you should visit your doctor as soon as possible. So onychomycosis is easier to treat if you catch it early, right? So most patients are able to see yellowing and thickening of the nail, as we can see in the picture as well. So at the times, the area around that toenail always itches, which is the main symptom of this one, right? So the nail gets brittle, like they get weak with jagged edges and deformed or detached. They can be deforming and detached. So you will see that your nail will get more deformed and brittleness will be there, and yellow thickening will be increased in respect of time. So it can become more worsened or advanced, that it will also give you a hard time to wear your footwears. So it's better that we should see the doctor as soon as possible. So what the doctor will do, the doctor will, scrape off all the dead layers or the tissue around the nail, and he can cut that nail. And when once he cut that nail, your symptoms, they will get relieved, like you will feel much better. So he can also prescribe you some topical antifungals, or in collaboration with oral antifungals as well, if it's more far advanced, right? So only topical agents cannot relieve this situation, or not cannot relieve this toe infection, because if it's more far advanced, we have to take some oral antifungals in respect to that. So, some of the antifungals which can be prescribed in this condition are like terbinafine, which is Lamisil, or we can say itraconazole. So, Zole family, right? Antifungal. So, like Sopronox and greasyfulvin, which is fulvicin, are some of the oral antifungal agents which can relieve this situation. So the regimen depends upon the treatment, how your doctor prescribed you these agents, between 6 weeks to 1 year as well. So there can be some side effects of the systemic treatment, including GI toxicity, liver toxicity, skin rashes, and sometimes other kind of hypersensitivities as well. So these medications should not be given to pregnant ladies. Like if there is a chance that you will get pregnant, so you should be contraindicating such kinds of medications and always taking advice of your doctor, because of effects on the fetus, right? So sometimes there can be a question that there will be list of drugs, and the question can ask you that to whom the drug is being contraindicated. So the pregnant or lactating mothers should be contraindicated, and they should always take advice with their doctor, so that they cannot take this medication, that it can also affect the fetus. And so I will be showing you the terbinafine medication, like how it looks like. And it's must that you should learn about the antifungal side effects. So this is one of your enlisted drug, which is terbinafine hydrochloride 1% antifungal cream. So you should be familiar with this antifungal ointment. And for the terbinafine, there can be some oral tablets as well. It depends upon your doc, that how he prescribes you. And the other some management tips for onychomycosis can be that you have to cut your nails straight along. Like as we, tell the diabetic patients that you have always to cut your toenails straight across, so that you can prevent the growth of fungus over there. And you should not have to wear about your high heels. Always wear flat footwears, right? And throw or wash your infected socks. And do not use these commercial instruments like the nail filers or nail cutters, etc., so that it can also prevent the growth of fungus, and it can prevent the worsening of the onychomycosis. So these are some prevention tips that you can guide the client, that they can use in their daily active routine, so that it cannot worsen, and they should do the regular follow-ups with their doctor, so that they can be doing regular checkups. And they have also to avoid some irritants, especially chemicals, some perfume generated scents, and they have to avoid trauma as well. So this was all about onychomycosis. Like if you have any suggestion, please do inbox me, and you can just contact me for any kind of guidance related to any topic you would like. Thank you for watching.